On this trip, Stevie hikes into the depths of Toronto Western Hospital, filled with the presence of busy hospital staff, in search of the ever-growing population of the senior patient. His journey takes him down hallways and into the artificial habitats of this unique human species. Seniors account for 14.8% of the population in Canada, and their numbers are rising quite quickly. 5 years ago, there were only 13.7% of the population. Now, on the 3B Outback, we could all agree that they make up about 98% of this population. Many of them mysteriously make their own way to the healthcare facility, and despite nurses' best efforts at admission assessments, not much is known about how many of these seniors live in their own habitat. What is known, though, is how to get them into pristine condition so they can be released independently back into their natural environment.
Here we are in the outback of GIM and cardiology. This is the forefront of leading nursing care. Today, we're going to explore the highly able ways of the nurses to perform top-notch care for these most delicate, well-lived specimens. Here is the senior patient. Now, they're often spotted in beds, hallways, and sometimes even beds in the hallways. Let's explore the nurse's secret recipe to getting these little fellas back into their natural environment. Now, you and I both know our elderly patients can get a little bit squirrely when they're outside of their natural environment. Hospital-induced delirium is a common yet mysterious phenomenon. We've tried our best to set up an ecosystem here that can be accommodating to this beloved population. Let's start by taking a look at what we've done with the doorways. You see? Contrasting colours. The difference between these colours make it easier for our seniors to identify the doorways and their own rooms. Look, here goes one now. All right. Can you believe that? So graceful. Now let's take a look at the matte finish on the floors. This addresses one of the seniors' worst enemies, glare. Glare, although still dangerous to you and I, is particularly important to reduce when your eyes fall victim to age-related changes. Seniors have an increased sensitivity to glare, so this special flooring makes it much safer for them to get around day and night. Let's take a look inside one of the chambers, shall we? Crikey! Night lights with motion detectors! It's all about safety here, mate. Brilliant. I'm hot on the trail of a mobilising patient. It's difficult to detect. All I can hear are the bells and stretchers. But listen. Did you hear that? We call this pathway the mobilisation speedway. You can tell it's been well travelled. Now I'm safe here, off to the side. To step into the middle of the pathway could mean getting trampled. When feeding time comes around, it's time to get out of bed. This happens 3 times a day, and working together is how we get the job done. We want our patients mobilised to their fullest potential. This will prevent the phenomenon of deconditioning, getting our patients back into their homes and keeping them out of rehab. Now, I don't need to explain to you how important it is to be washing your hands. We all know that hospital-acquired infections migrate from room to room on unclean hands. Hand hygiene. Our goal is 85% compliance. We take great pride in this here. You can see those nurses hitting those dispensers with their hands. We perform regular audits to keep our numbers up. Yes! Let's talk continence. It's important to get upwind for these tasks. Now, diapers are not a natural thing. They're artificial, and when used on the wrong patient, can be very dangerous. Let's take a look at one of these nasty things here. When patients are wearing diapers, they're laying in sweat and body fluids. This can lead to skin breakdown and cause rashes and sores, not to mention our number one predator, deconditioning. If the patient came in with a diaper, diapers are not to go near them.
What happens on nursing rounds? They attend each room on their travels and use teamwork to get each patient all that they need. They toilet the patient, clean their rooms of foreign objects, check their blood sugars, and, you guessed it, what happens at 11:30? It's time to get up for lunch. Yum! Efficiency, that's what this is.
So what's the meaning of all this, you might ask? The nature of these rounds make them ideal for fostering an environment with patient satisfaction. The senior population feel more secure in an environment that they know they are well taken care of. Seeing friendly faces in a team setting, tending to their needs, makes them feel safe. And as you know what they say, a happy patient means a happy nurse.
While nurses are on their rounds, they're focused on the patient at hand. Their super keen eyes make them perfectly suited for detecting hazards that could pose risk to this population. Removing furniture and debris out of the immediate environment and placing items such as tray tables, water and telephones within the patient's reach are all steps to decreasing falls and improving safety.
So a lot of seniors will say, those nurses, they're pretty bossy going around moving this and that, making us seniors get out of bed. But nuh-uh, that's the proper way. That's how we intervene with deconditioning.